Cognitive Theory, From Principles to Practice, presented by Shireen, Alan, Ashley, and Amber.
Identifying and defining cognitive theory. Cognitive theory stems from traditional psychological concepts of thinking, combining behavior and cognitive theory. During the 1950s is when the cognitive revolution began. Basically, behavioral therapy discusses how our actions are affected by what happens before a behavior and the consequences that follows. Cognitive theory builds on behavioral theory by suggesting that thoughts, not just consequences, influence behavior. If behavior therapists believe that we can educate clients on how the consequences of their behavior can deter future action, then cognitive theory is similar in that by educating clients on how their thought process affects their emotions and behaviors, then clients will change the decisions they make in the future. One form or intervention of cognitive theory is cognitive behavior theory, which combines cognitive theory and behavior theory. Cognitive theory concepts basically are focused on how we think and understand things, how we comprehend and see the world around us, and conscious thinking. CBT, as stated previously, is a form of cognitive theory and intervention. It is a short-term goal-oriented psychotherapy focusing on distorted thinking and core beliefs, which influence an individual's thoughts, behaviors, and emotions. So the thought process on this approach is if an individual changes their thoughts, then this can reduce symptoms associated with the mental disorder. CBT can be effective to a wide variety of clients, from those suffering from depression, anxiety, to those with drug or alcohol abuse. The advantages of CBT are that it is short-term, being 5 to 10 months for most diagnoses, with one session per week lasting 50 minutes. As stated previously, CBT focuses on the client's distortions and core beliefs. The theory states that if one identifies their core beliefs and distortions with the practice of mindfulness, symptoms of anxiety and depression can be reduced in a short time. Cognitive distortions are a negative thought process of thinking which influences the client's emotions and behaviors.
Hi everyone, I am Alan Donald, and in looking at uses for interventions which were based on cognitive theory, we found that there were several common practice settings, including community practice settings, inpatient and other settings, including school-based, jail-based, and even workplace settings where cognitive theory was used. Applications were diverse and universally showed promise, though some had a larger effect size than others. For example, substance use disorders, the effect size was small compared to other interventions like motivational interviewing or relapse prevention, especially when looking at certain substances, including opioid and alcohol. Psychotic disorders, there was a medium effect size for both positive and negative symptoms. For mood disorders, it was found to be superior to psychodynamic interventions. For anxiety, it was the first-line approach. And for other uses like body dysmorphia, insomnia, eating disorders, personality disorders, anger management, chronic pain, and even smoking cessation, it was seen to be helpful. For adolescents, they showed significantly better outcomes with cognitive theory-based approaches compared to no treatment, other treatment, or medication. For the elderly, there was promise when compared to reminiscence, and there were very few studies that looked at minority populations. Universally, it seems that scholars agree that there should be more study done, and that when using a cognitive theory-based approach, there should be adaptation for cultural competence. Thank you.
The ease of cognitive theory's application extends itself to other social work theories as well. Cognitive theory is easily combined with other theories, the most popular being behavioral theory, which has led to the widely adopted cognitive behavioral therapy, or as it is most often referred to as CBT. Because cognitive theory focuses on what a person is thinking as that directly affects their behavior, this theory delves deeper under the surface of a client concern, enacting changes that influence how the person is as an individual and how they interpret and react to situations. This symptomatic change that comes from implementing cognitive theory into practice is a great strength, as it is not just addressing the concern at hand, but can impact the client in other aspects of their life as well.
Let's discuss the limitations of cognitive theory. Cognitive theory does not exactly translate well to larger systems. It is very useful in micro practice, but it does not have great applications in macro work. It also does not really account for systemic influences that come from larger systems, such as the family unit, communities, or even cultures. Additionally, it's important in social work to consider a person's environment. We want to know how that environment may impact a person's functioning, the choices they make, the barriers they face. But however, cognitive theory does not really examine this influence. This lack of consideration for culture can make it difficult for a social worker with knowledge or practice skills grounded only in cognitive theory to deliver culturally sensitive services. In modern-day social work practice, cognitive theory is often combined with complementary theories to offer a more comprehensive approach. Frequently, cognitive theory is melded with behavioral theory to create cognitive behavioral theory. Another popular combination is social cognitive theory, which helps bridge that knowledge gap in considering how people interact with their environment, or other factors like culture and the influence of larger groups like communities. Cognitive theory can offer a strong base of knowledge for understanding thinking patterns and conditioning. However, to deliver the most well-rounded and culturally sensitive practices in our field, cognitive theory is best used as one tool among others. Cognitive theory can be complemented by other theories, which help to make up for its limitations.